Welcome back to Wake Up America Weekend. Now, despite the Supreme Court decisions to overturn Roe v. Wade back in 2022, abortion in this country remains at an all-time high, with more than 1 million abortions taking place in this country in 2023 alone. Now, that's an alarming new study that's been published by the International Journal of Cardiology, Cardiovascular Risk and Prevention. It puts forth evidence suggesting abortion is an independent risk factor for cardiovascular diseases, or CVD, which is a leading cause of death amongst women.
Joining us to discuss this is the president of the Life Issues Institute, Bradley Mattis. Bradley, thank you so much for joining us this morning. What do you make of this study? The studies claim that there is an 18% increased risk of cardiovascular disease among women whose pregnancy resulted in a pregnancy loss. Now, this actually, we need to be clear, this includes stillbirths and miscarriages too, not just abortion.
Yes, it does.
So why are we raising the alarm bells now?
Well, it's the width and breadth of this research is pretty impressive. They looked at over 1 million women between 1999 and 2014 who were Medicaid eligible. So the information is dependable. We're not depending upon somebody recalling whether or not they had an abortion. And the researchers looked at this every which way that they could, examining whether a woman had a pregnancy or not, or CVD or not before the first live birth. And in all 5 groups of women, in every case, if she suffered pregnancy loss, then she had an increased risk of CVD. And, you know, this echoes other research that is done in this field. So it's not a new finding, but because of the width and breadth of the study, it certainly adds credibility. And now, we know from the American Heart Association, who are cautioning women who have suffered a miscarriage that there is an increased risk of heart disease. Whether or not they will tell women that there's an increased risk of CVD after an abortion remains to be seen. And if the way they handled abortion and breast cancer connection is any indication, you know, that's a concern for women's health.
Well, let me ask you this. A study from the American College of Pediatricians said that abortion prior to 32 weeks gestation may also increase a woman's risk of breast cancer, as you were just saying, especially if she has a positive family history of breast cancer or has an abortion during her adolescent years. So can you just tell us very quickly, in about a minute or so, what is the link between having an abortion or a miscarriage or a stillbirth and breast cancer?
Sure. The science is pretty simple when you look at it. If a woman has never had a child before or a pregnancy, the cells in her breast are undifferentiated, meaning they have not formed to provide a specific task or purpose. Once a woman gets pregnant, those undifferentiated cells then evolve or grow into milk-producing buds so that she can feed her children. And when this process is happening, those cells are more susceptible to cancer because of that quick change. If she has an abortion and miscarriage, of course, some of the science is conflicting on the miscarriage part. Certainly with an abortion, she increases her chance of having breast cancer. And we know all along that it's known science that if a woman has a child, that is an extra protection for her against breast cancer. So again, we're building on science that is already there, and how this has been politicized at the cost of the health of millions of women is nothing less than a tragedy.
Well, that's something that I think is wrong no matter what. Whether you're pro-life, pro-choice, stillbirth, miscarriage, all of the information should be given to the patient regardless.
But it's also as well, there's so much information out there and so many studies, and they all have different conclusions. There's so many studies that say that makes no difference to a woman's health.
This one with a million study, that's a big one.
I disagree with you somewhat on that. The science going back to 1957 and the overwhelming amount of science internationally points to a connection. There are those studies that say no, but when you look at them under closer scrutiny, there's a reason why we shouldn't really consider them in the overall scheme of the worldwide research.
Fair enough.
Fair enough, but I still say there's still a lot of it. You know, it's science always has, it's always evolving. So let's just leave it at that. Bradley Mattis, thank you so much for joining us this morning.